Okay, so basically this is your letter. So we can see there, like this is the medicine like Snesser from the nursing side, from the OET official website. So basically, we can see there, like we have the person to whom we are writing. We always see this thing. The person is senior nurse, right? So you have to put yourself in the shoes of senior nurse, who is a senior nurse at Grey Wall Nursing Home. So, in simple word, you are a nurse in nursing home. So you are a nursing home nurse. So from this point onward, you have to think this case as you are receiving a case to follow the continuation of the care that has been done in the hospital with the discharge plan, whatever has been done. He has to ensure that this plan should be followed. So now this is the first thing you have to understand being a nurse, right? So whatever you are right now, if you're working in ICU, if you're working in the ward as a ward nurse, if you're working as like emergency department, so forget about your profession. Just think like if you are a nursing home nurse and you have to look after the patient for continuing care. So this is a nursing task that has been assigned to you in this letter. Anyhow, so we can see that first of all, might be we can find the reason that had happened. She underwent a left hip replacement surgery and there is ongoing blood pressure. So at least we have some idea about that. So now we can see that this is a discharge plan. Monitor the medication, specifically the Panadol food and maybe this medicine. Preserve skin integrity. It's important to see. Continue exercise program. Whatever exercise program that is ongoing, we can see that the case notes. This was the stretching and strengthening exercises. So this is the instruction. Equipment required for this exercise program is wheelie walker, wedge pillow, toilet razor. So you can see that following equipment will be provided by the hospital and the toilet razor will be arranged by the social worker. So how would you exercise? We will see it. Okay. So in the assessment part, so just to give an idea, she is improving, whatever the patient, sorry, he, she, I don't know, I need to see the patient. The patient is improving and she can also, tolerate the weight with the help of wheelie walker, and the ability that she can walk without difficulty is the length of the ward. So now post-operative disorientation and then drop HB in the modern, we'll see in detail afterward. Drilling dressing has been done. These are the exercises that was performed, then occupational therapy, staples and so on. Okay, now we can see the case note from top to bottom. Over here, now we can see that the Mr. Gerald Baker is 79-year-old man. He is in your ward and you are a charge nurse. So now the things will be more clear. Charge nurse is writing this letter to nursing home nurse. It's not important who is writing, but it is important who is receiving. So accordingly, we will select the case note and the type of line we will be using over here. She is a senior nurse, so we have to give instruction, but in a polite manner. Okay, so basically you can see that marital status widow hai, admission date this one, discharge this one. This is basically the date on which we are writing this letter. We already discussed this thing. This is a very important point for you to understand. She is living at Grey Walls Nursing Home. So it means that the past medical as well as social history will be known to this patient because the patient is resident of this nursing home. So all this information, like we can say there, all the information such as no children, employed as AD engineer, age pensioner, hobbies, family members, okay, and we will not write down anything. It's totally irrelevant for the person. Similarly, osteoarthritis, won't write it down. This is not write down because this is ongoing condition, so we will write it down. Okay. Anyhow, so followed by medication we write. So how would we start this case? After writing the introduction, we can write it down. The introduction in this way. I'm writing this letter regarding Mr. XYZ, whatever, Mr. Gerald, Mr. Baker, a patient of yours, right, who underwent a successful left total hip replacement surgery and is being discharged today into your care for the discharged today back to your nursing home for the continuation of care along with the management of her ongoing blood pressure, high blood pressure, right? So that was the introduction. So next paragraph, Organization is always challenging, but you can see that in this letter you will also learn the organization part. So now we will be confused from where we can start, from here, there, or from here, as normally in discharge letter we have a ward stay, so we can start directly with the ward. So you can see from this point, we got the first event after the surgery. So post-operative disorientation. So we can start from this line. After this part, we can start from there. There was a drop HB, for that you have done, and we can give the instruction right away. For example, post-operatively, she was not oriented to time and place as she was recovering. We believe that it could be due to the effect of anesthesia. Hence, it would be appreciated if you could observe the patient. I would recommend that if you could observe the patient, like in this regard. Then you can write it down about she also had HB drop of, she also had HB drop post-operatively, consequently, let's say like that, and then you have to request the patient. Then followed by, we need to move on toward a dressing incident point. We start with the dressing incident point. After dressing, we can write down about the staples. And then in order to improve her range of motion, we started the strengthening exercise, and also nursing management include the occupation therapy. We won't write it down, this thing over here right now. So, or maybe at the end when we write down about this point, we can write it down, the full blood examination as well. But this could be written at the end. Anyhow, after like first point, second point, third point, fourth point, fifth point, then sixth point. After writing this point, we can also write it down due to her low HB. It would be appropriate if you could follow up for the full blood examination and urine creatinine test at the city hospital, okay, post discharge. Then we can write down at the time of discharge, let's say, then this point, she was like able to walk appropriately. Her mobility was good. Post operatively, like she was having adequate mobility after the surgery, as she would be able to walk a total length of ward without any difficulty, and she can bear the weight with the help of wheelie walker, right? We can write it down this point in this way. Then it would be appropriate, if you could ensure her discharge plan, for which you need the following equipment. Let's say the wheelie walker and weight pillow, which will be provided to you by the hospital, and the social worker has already arranged the toilet razor for 2 weeks from the local medical supplier. Hence, you are requested to continue the exercise program which had been done in the hospital. Please ensure that her skin integrity should be preserved, right, like that. And patient has had hypertension since blah blah time, and she's also has been taking blah blah medication. So it would be appropriate if you could monitor her medication. Then at that you can write it down if you have not written this thing over here. So it would be appropriate if you could follow up the case with the city hospital for her full blood examination and urine creatinine test, and the patient has low HB in the hospital, so that we can monitor her for the risk of anemia. So either you can write it down when you will be writing this thing over here, or either it can be written at the end. I hope this organization will be understandable to you. We just have given you a complete sketch. So if you want to ask any question, you can join M&M, or you can comment down this video. So one of our assessor will guide you on that. But we are open for the classes at M&M, I8 Markers, and also you can join us online if you have any question regarding your writing, speaking, reading, and listening skills. Thank you.